Pregnancy Considerations, Case Study 5-3, Twin Pregnancy, presentation by Sabrina C. Nash. My client, Senora Mendez, is pregnant with twins. Yay! She had a pre-pregnancy weight of 142 pounds and a healthy BMI of 23. After sending her for a nutrition assessment, the results revealed that she had gained 14 pounds since conception. She had a low EPA and DHA sources in her diet, and that she also had a low vitamin D status, making her deficient. To figure out how much weight in pounds that Senora Mendez needed to gain in order to meet the recommended weight gain for a twin pregnancy, I first reviewed the recommendations per trimester. And I seen that during the first trimester, you're supposed to gain a half a pound per week. During the second and third trimester, you're supposed to gain 1.5 pounds per week for a twin pregnancy. So then I totaled up the recommendations to get 40.5 pounds of expected weight gain. Then from there, I subtracted the 14 pounds that she had already gained to get 26.5 pounds needed. I then took the amount of weight that she needed and divided it by the 13 weeks that were remaining to get 2 pounds of weight gain recommended per week. This chart here shows her diagnosis and her interventions and her evaluations. So the first one is to address the underweight status. And to do this, I recommend that she consume 3 meals and 3 snacks per day to get an additional 500 to 1,000 calories in her diet. And we're recommending her target goal is to be between 2,800 to 3,300 calories per day. Again, to test this, we're going to check her anthropometric measurements during her weekly visits to see if her weight is actually increasing. Then we want to address the vitamin D deficiency. Because she is deficient in vitamin D, I recommend that she take in 15 micrograms daily. And also during some of her snack time, she can have cheeses and milk, which are a great source of vitamin D. In order to test this, we will be looking at a biomarker, which is blood, to see how her status has improved at week 30. Also, with the DHA and EPA, we're going to be addressing her low omega-3 fatty acid intake, and we want to address this by recommending that she take in 2 to 3 servings of pregnancy-safe fish like salmon, cod, or catfish, or even a 500 milligram supplement. And again, we're going to be using the biomarker evaluation of blood during her 30-week visit to test this and her vitamin D deficiency. Below are the references that I used in order to complete this assignment. Thank you for joining me.